Welcome back into Live Now from Fox. My name is Anna Marsig. Take a look at this X post on your screen there coming from the Washington Post saying a Kenyan court suspended a Trump administration plan to establish a makeshift field hospital in Kenya to quarantine and treat Americans exposed to or infected with Ebola. That ruling came the day that U.S. officials said the facility would begin operating, which was set for today. Fox News correspondent Garrett Tenney has more.
Enhanced border screenings across Central Africa as an Ebola outbreak in the Democratic Republic of Congo intensifies.
There are multiple strains of Ebola, and this strain is the one that's a little bit more rare.
Now, a court in Kenya has temporarily suspended the Trump administration's plans to open a quarantine facility in that country for Americans exposed to the virus. The 50-bed center was scheduled to open on Friday, but faced legal challenges over cross-border infection risk.
There had been no transparency around impact assessments, around contingency measures, around the procedure by which this was approved.
It comes one day after Kenya's government provided written approval for the site as part of a coordinated public health response with the U.S. that Secretary of State Marco Rubio says includes more than $13 million for the East African country's Ebola preparedness efforts.
The State Department and other agencies represented here, the Centers for Disease Control, HHS, others are working very, very hard to contain this crisis to the countries where it's currently located.
So far, Kenya has not recorded any Ebola cases, but in Congo, the World Health Organization says the outbreak is growing faster than the response efforts can handle.
There are many challenges, especially in containing this outbreak. It's a very complex outbreak.
4 U.S. airports are screening Americans arriving from affected countries, but health officials say the risk to the public as a whole remains low. In Chicago, I'm Garrett Tenney, Fox News.
Now, of course, this is creating a legal roadblock for the administration's plan to keep the deadly Ebola virus out of the United States. And at the same time, a confusing double standard is playing out at our own borders. Well, foreign nationals and lawful permanent residents from the impacted regions are completely banned from entering the U.S. Certain returning American citizens are being funneled through 4 designated domestic airports for enhanced health screenings. That stark divide between who is allowed to fly home for monitoring and who is entirely banned from the U.S. airspace is raising some constitutional questions. So joining us to break down this collapsing international agreement and the legal rights is the WHO's director on the Center of Global Health Law, Lawrence Gostin. Thanks so much for joining us here on Live Now from Fox.
Good to be with you, Anna. Thank you for having me.
Of course. So with the Kenyan High Court temporarily blocking that quarantine facility in Kenya, those exposed Americans in the DRC are now in a legal and logistical limbo because the U.S. seemingly has no foreign backup. So does the Constitution legally compel the federal government to return these citizens immediately, or can the administration still deny them entry?
Well, as you know, if you going by the law, the Supreme Court has been very, very clear for quite some time. United States citizens have an unqualified and absolute right to return home. I think that's the best thing legally, but it's also the best thing for Americans. Ebola is a very complex and a very lethal disease. You can't treat it in a makeshift field hospital on a military base in a foreign country. Republicans and Democrats alike, for all of the 17 Ebola outbreaks in the past, have always brought Americans home to specialized facilities in Atlanta and Nebraska, and we've lost not a single American life. And I worry that this could really cost lives.
You know, this creates kind of an interesting picture because the current travel restrictions are creating a deeply divided system for people who are trying to return from those outbreak zones there in Central Africa. The government has banned foreign nationals and lawful permanent residents from entering altogether, but they're allowing some U.S. citizens to fly into those designated domestic airports for screening. There's 4 of them set up. And, at the same time, they tried to force those other high risk but asymptomatic Americans into the offshore quarantine camp there in Kenya. So under U.S. law, what exact criteria gives the government the authority to slice up those travel rights like that? How do they legally justify telling one asymptomatic U.S. citizen that they can fly into one of those screening airports while telling the others that they're banned from the U.S. and that they have to be quarantined?
Imagine being able to build anything just by thinking about it. Meet Base 44, a complete AI creation